think Tavi in Asia, we started a bit late than our European, than our US counterparts, but we are catching up. Look at the population of Asia, we have a huge potential for the technology to take off in Asia. But there are specific problems in Asia that we have to bear in mind for our Tavi patients. First of all, our Tavi patients are older and of smaller build. So if you look at the anatomy, they have smaller annulus, so that makes the device choice much more important. They have very calcified aortic valve or the annulus, and then they have a very narrowed or small iliofemoral artery. And if you look at the Chinese data, we have a lot more bicuspid aortic valve. Bicuspid aortic valve is a group of patients that would pose much more difficulties than the usual tricuspid Tavi patients. So these are the challenges we are facing in Asia when we are talking about the Tavi procedure. But as I mentioned, the population is huge, the cases are going up. We will be seeing a lot more Tavi procedures being performed in this part of the world. If you consider the access, we know we have the best results from the transfemoral access, but since a lot of our population have very small or calcified iliofemoral arteries, alternative access might become important for us. So what we are having nowadays is we can go from the axillary artery, transaxillary. We can of course go more invasively. We can do a direct aortic approach, transapical approach. But what has been shown today is the transcarotid approach. We go from the carotid artery, and the procedure will be easy, but we might require multidisciplinary team working together with our vascular surgeons to get carotid access for us, the conduit, so that we can perform the Tavi procedure, even for those patients with iliofemoral calcification or small vessels. And the last option we have is what we will be doing in Hong Kong very soon, is the transcaval approach. So we go from the femoral vein and then go through the IVC all the way to the descending aorta, infrarenal aorta, so that we can actually bypass the iliofemoral access and finish our Tavi procedures. So this is something that we have to develop in the very near future, considering the limited iliofemoral access for our Asian patients.
The role of left atrial appendage closure for stroke prevention, I think this field has really expanded over the past decade or so. And I think in patients currently with contraindications to oral anticoagulation, LAA closure really has a very important role to play. And we're seeing definite increase in volume, and as well with improvements in devices, the new iterations of devices like Watchman Flex. It's really made the procedure safer and faster to do, and we also know that there's good efficacy results as well. So there's a lot more confidence from referring physicians now for patients, with atrial fibrillation, the non-valvular atrial fibrillation, and especially those who cannot be on oral anticoagulation because of bleeding issues and other contraindications. They're great candidates for this procedure. Yeah, so the Watchman Flex is a definite game changer in this space. The device, because of the construction of it, it has a closed distal end, so it really makes it very safe. And if you look at the risk of complications like pericardial effusion, pericardial tamponade, it's a lot lower with this new generation device. And it's also a lot easier to use. So the procedural time is shorter, complication rates are lower, and so the adoption, I think, for this therapy has increased because of this new generation device.
30-second SingLive is actually giving an insight to the young interventional cardiologist. So far, whatever we think in intervention, usually we think that we are adequate to that. It is not true. Every year, every moment, data coming up and the interventional skills coming up. What actually SingLive gives you as the precision imaging, which will make you better in outcome. Basically, LMC intervention, when you look into the LMC intervention have calcified lesions, you have a bifurcation lesion. When you do these things, you should have the image guided PCI intervention, gives you a result almost equivalent to the surgical result. That will make you to do a better interventional outcome in the long term. So that I advise you to the young cardiologist, you should actually visit this meeting, which is actually very important for the Asian society, but not only it's confined to the Asia, but internationally it is a meeting which is coming up in such a level that you will get to know what is coming up in the new era of intervention. That is what SingLive gives you.
Yeah, definitely. I am Dr. Vinit Kumar from India. Just after presentation, I got the best paper award. That is also very big thing for me. Very much thank you for that.